Okay, everybody, so we're back. So would you like to explain to everybody what's going on?
Yes.
Okay.
So about 8 years ago, I had a bunion surgery. I was a flight attendant, wore high heels all the time, and had very painful bunion. So I had the surgery. After surgery, though I went to physical therapy, no one really spoke to me about how to walk on my foot. So rather than put the weight on the big toe, I put it on the pinky toe. And over the years, I developed a neuroma, had different physical therapy over a number of years, and then it just got worse.
So what's a neuroma?
Well, I believe it's scar tissue that has developed on the nerve.
There you go. And when did you learn that?
Well, just recently.
No. Okay, all right.
But through physical therapy, they did ultrasound, they had me do exercise, they did cortisone shots, which only made it worse. So the doctor wanted me to do a shot that would kill the nerve. And I thought that only could lead to bigger problems. So I took a break from doing physical therapy, and just started stretching my toe and putting essential oils and rubbing it into the neuroma and castor oil. It started to get a little bit better, so it is a little bit better, but it's still there. And now there's a separation between, I guess it's my third and fourth toe, and there are times when I'm walking, I get this shooting nerve pain that goes to the very tip of my third toe. And it's very painful. I can't wear anything with a little bit of heel. These are fine because the soles are really firm, but if I wear a cushion like a sneaker and there's any bend in the toe, it hurts a lot.
So does everybody starting to understand it's always a scar tissue issue? With crystallization? The crystallization is lactic and uric acid. It actually gets sent there. That's the glue to bind the fibrin together, to make it tight, to make the wall. And if it goes on for too long, you're pulling calcium if the inflammation is too long, too strong. And the calcium goes in to make a cement wall. Cement wall. Calcium. Yeah, go ahead.
Okay. I'm a podiatrist as well as a chiropractor.
Mm-hmm.
Yeah.
Okay. And
You want to speak louder though?
sure,
So everybody can hear you?
as a podiatrist and a chiropractor,
Right.
okay, what you're describing is real technical, but if we just put it in street terms, I would say that neuroma is just a swelling of those two nerves that come together. You're not wrong, you're right.
No, it isn't. So just so you know, the swelling is actually from the scar tissue now, and it's inflammation. Nerves don't swell. Hello. Okay, so let's make that perfectly clear. Okay, so guess what? Neuritis means inflammation, and the inflammation is around. The nerve can get a little bit red, okay, but it's not where the swelling comes from. It's still the issue's in the tissue.
I agree.
And understand something. Does anybody know why you have nerve pain? It's because the crystallization is like glass. And when she goes to walk, the glass from the crystallization of the lactic and uric acid and the calcium that's going there to buffer down the acidity is poking the nerve. Now, the scar tissue wraps around the nerve to try to stop the crystallization and the calcium from poking at it like a needle. So if we go in and pull the scar tissue apart, and what are we doing? We're going to increase the blood flow and the lymph flow, but we're also going to create heat. If you bring up the temperature, the lactic and uric acid will melt, they'll go away, the calcium will flow away, and guess what? The scar tissue will turn instantly back into connective tissue. People go, so where did that big lump of scar tissue go? Am I going to have a heart attack? And I'll go, it didn't go anywhere. Your body, when the lymph flow and the blood flow increase, it's carrying light. And the light turns the scar tissue back into connective tissue in a New York second. That's it.
And I will agree with everything you just said.
Well, it doesn't matter if you do or you don't.
Okay, well, anybody would, okay,
But I know, but I
agree.
need you to understand that it doesn't matter if you agree or not. The reality is, why am I so successful if it's not right? So the reality is this, is that it's a scar tissue calcium crystallization issue. It's not a nerve issue. When you restore the area around the nerve, you restore the nerve.
Can I?
Yeah.
And I agree again. But what I'm saying that most of the patients that will come in my patients and other patients wouldn't take that physiology because they're not glued to it. I mean, they're not thinking about that. They just,
Oh, wait a minute, but that's because practitioners do not have this philosophy. That's why patients do not have this philosophy.
Agreed.
And that's why patients have no patience. Because no one has ever taken the time to explain 1, 2 is buckle your shoe, 3, 4, you're out the door.
And agreed. And
Yeah.
surgeons are not going to do that because that's not where their money is.
Well, no, because surgery is surgery.
Because surgery is surgery. It's not where the money is. And that's the reason why they'll tell us to just go in and clip that out. Which is, I use surgery as a last result. I enjoy
Oh, but hold on a second. But you use surgery as a last resort. But guess what? I guarantee you after today, that resort is going to take a lot longer now. You're not going to go to surgery because you didn't have the information that you have today. And guess what? Everybody out there, whether it's a surgeon, whether it's a natural health practitioner, or somebody I train, we can only do what we can do with the information we have. People aren't bad. Their belief systems can cause trouble.
because we're not trained that.
That's right. So I'm not putting the blame on doctors. I'm not putting the blame on surgeons. I'm putting blame on, we got to go way back, and I don't even want to tell you who that is. The reality is this. It's a scar tissue issue. And as long as you stay inflamed long enough, you're going to have to buffer it down with calcium.
Okay.
Okay. And then guess what? When you crystallize and you have calcium deposits, come on, what do you think spurs are? What do you think?
Okay.
They're calcium. They're displaced calcium, and you're getting that because there's so much calcium being pulled. It's the same thing as barnacles on a boat.
We're not saying different things.
No, we're not.
Okay.
No. Me and you, we're not debating.
No.
No.
No,
Okay.
because you can do that outside on your own. Oh. There's
Okay.
other people here, Wayne.
Okay. I agree with you. Okay.
Yeah.
Okay. But just to say how surgeons would do it, which is probably what they were trying to do, which would be to go in there and cut that out, and they would describe it as tumors. Or that's what they would. That's what.
Okay, look.
But it'd be wrong.
Everybody that has a profession means well. And they really do. It's not like there's evil forces that are in the practitioner world. So let's put that aside. The reality is, it's just not turning out really well for a lot of people.
Agreed.
Okay, that's all.
Agreed.
So we just want to make it turn out better. Okay, so all I'm saying is before we jump the gun, okay, let's just give our body a chance.
Totally agree.
Okay, all right, so what I want to do is let's have your head here.
Okay.
Okay? Okay. Okay. So what we're going to do is we're not going to do a full treatment. If I took an hour, okay, if I took an hour to work on her foot, I'm going to tell you right now, minimum, we'd have a 60% turnaround. That would be minimum. Okay? So let me just do this here. Okay, there's her foot. Okay. Now I'm going to have you put your leg like this. I'm going to sit like this. I'm going to put your foot up here. Okay, so you're saying that this toe is shortening.
Yes.
Now the only reason why this toe would shorten is because the tendons and the ligaments in here are shortening. Okay, so let's talk about it properly. What's shortening?
The toe. The
No.
ligaments. I'm sorry.
No.
The
It's okay. Don't be
tendons.
sorry.
Yeah.
Don't ever be sorry. I just want to get it right.
Right.
Okay? All right. So what we're going to do is when we work on someone, whether it's arthritis or anywhere else, we're going to go in here, use our elbow, And these are the lymph channels in here, okay? And do you notice the coloration here? Feel the foot? The foot is freezing.
Yeah.
Now, up here it's a little warmer, okay? Warm. So now she's got good circulation here. The circulation is not good here. Now, did you ever hear the saying, stiff as a board? Well, okay, so when something's cold and really stiff, they're dead. Right? That's called a stiff. So now, why would she be so cold right from here to here? You can come and touch her if you want. The freezing doesn't start until right here. Actually, the cortisone shots even made it colder, made it worse. Because they will work for a short period, but then it'll turn on you. Okay? So right here is as cold as ice. It's cold as ice. So we know that, okay, is she cursed by God, or is there a physical block in there?
Physical block.
That's right. So that physical block has got to be scar tissue crystallization or calcium. So if I could go in here, and I would go in here, okay, I'm going to show you something, okay? You know, where do you live?
Miami.
Miami, okay. I'm coming back in September. If you come in September, that foot's fixed. And then I'll have you come on Facebook, and then you can tell everybody I'm a liar or I was right. So the reality is this. If I could spend 1 hour right here, and then I would teach her how to do what I do on her own foot. Okay? Yeah. No, it's called one shot. And you can use it by using an essential oil bottle, but we have a technique that she can actually use. And then she'll also do patting and clapping. Make sure you come on that, because even the patting and clapping might bring this back. So with that and the deep tissue. Okay, so here, can somebody come here for a second? You want to hold this? Hold this right here. I want people to hear this, and you'll hear the crystallization and the scar tissue. Hold it right about there, but not in the way. Okay, now watch. Go close. Go closer. Hear it? Okay. So all this are like tight wires now. They're all tight wires. So if I were to go in here and spend 1 hour right here, I guarantee you that this foot would have its heat. Okay? She should also be using what's called DMSO on him, but you want to use the DMSO gel, and then once it starts to come back, then you use the DMSO rose cream. You can see on my website. And you also want to use what's called pain away essential oil. Okay? All right, but you want to be putting it on a lot. All right? And you want to get a foot roller and start foot rolling.
Okay.
Okay?
The foam has there too. That's probably the neuromas first thing.
Well, I have a lot of neuropathy on both sides. I mean,
Okay.
if you saw my other.
You know what? If we were here for like a day, we'd fix it. And I don't mean to be like that.
No, I
Well, if you
understand.
could fix it, just fix it.
Right.
You know, the reality is, if I could spend an hour from here, but also this is called the horseshoe. You got to go into the ankle and clean out clean out the lymph nodes, right? Clean it all out, and then go and clean each joint, because the secrets lie in the joints, okay? And then this whole thing would be, and then we'd flip her over, and we'd do the same thing. I would go into your toe pad, and, okay. Here's to prove my point, so that people don't think I'm making this up. In 2 weeks, I have a lady coming, and this lady that I worked on, we're splicing it right now. She had arthritis so bad that the joint was sticking up 1 inch. I took it down in 20 minutes. It's on video. I took that down in 20 minutes by 70%. When I worked on her joint right here, guess what happened? 20 minutes, by the time I only worked this one joint area, her whole hand went black-gray. Guess what that is? What happens when people die? That was actually the death coming out of the joint. Now, the next day she calls up, and the grayness and the swelling came all the way to her elbow, and I only worked here. That's how much emotional pain and infection and inflammation was in that area. You're going to see it all on video. And also, if you want to go back, you're going to see, I worked on a lady 3 weeks ago, and she had a tumor in her breast, this big. I worked on it for 10 minutes, and I reduced the size by 50%. All right? So I'm trying to tell you that it's all the same thing. Now, when you're dealing with an actual tumor, we'll be working on him in a minute, a couple minutes. The reality is, how much anger is in it? The more angry it is, the harder it is. The more calcium is going to be in there, the more tight the fibers are going to be. And it actually is an emotional issue. Now, the more angry it is, the more gentle we're going to be. Because if I come up against anger, anger's going to be pissed off. So I'm going to go in there gently. If it's not a real tight fibroid or tumor, I can go in and lovingly pull it apart. But I can tell right away if I go up there and it feels like you're hitting a wall, I know that it's anger. So I'm going to work around it first. I'm going to tell you something. We worked on a lady with a tumor. I already talked about it this afternoon because I only want to talk about my latest cases. So anyways, we worked on her. We never touched her tumor, which was that big. Okay? And we worked on the area around it, and it came down by about 40%. Never touched it because we went around the area around it and made sure we loosened up everything. So guess what? What tumors do and what fibroids do is they cut off the normal blood supply, okay? So they try to make it scar tissue all around the area, and then they have their own little roots that they do to feed themselves, but they want the area to be low vibrational like the tumor, because it's low vibrational. So we went around, we just loosened that up, and then we went in 2 days later, and then we worked right on it. And like I told you, we reduced it, it was down by 65%. And then I left. So anyway, so now they're going to come back. She's going to come back with her husband, and we're going to teach them how to do this. And now what practitioners would say, and doctors would say, you have no right. And I'll tell you something, everybody has a right. Everybody has a right. Okay, so let's just get rid of that.
I was going to ask you, then, how often and how long should she be working?
Okay, first of all, is she going to drink structured water? Is she going to do... I know, but you don't need to because I know you're doing things already. But I meant the person. Everybody's different, right? So I'm going to go through a few things. Yep. Is she going to stop reacting? If you don't notice her voice, it quivers, which means that she was terrorized as a child, and she's running a terrorizing program in the subconscious, which means that she's continually dripping adrenaline and cortisol into her body, which means that that's why this thing is so bad. So is she going to stop that? I'm going to tell you something, and you can believe this or not believe this, and I can tell you right now, I guarantee you the lady's listening. She was at my place 4 weeks ago, and her quivering was 5 times, 6 times worse. And I said to her, what's going on? What happened when you were a child? Nothing. I said, no, you got this from someone. You got it from somewhere. She goes, oh, my father does this. And when I was 6 years old, okay, I started doing it, and I said, yeah, that's because you sympathized with him and you felt bad for him and you wanted to let him know that you loved him. And I said, guess what? You know what's going to happen here? Your kids, one of your kids are going to start doing this because the one that sympathizes with you the most and is the closest to you is going to start doing it. She goes, oh my God, my son. I said, how old is he? He's going to turn 6. And he's just started. And I said, guess what? You stop it today. You stop it today. And guess what? If you love him, you'll stop it. Because now he's going to take it on. Welcome to the family curse. And guess what? She didn't do it after that. Do you understand something? That guess what? I understand it. It's called love. It's called I feel for you. No one else can help you, Daddy. I just want you to know that you're not alone. And that's okay, but it's not okay. Okay, all right. So, yeah, so we would go in here. Feel it? Look, it's so much. It's just loaded. Now, when I get done, believe it or not, this foot would be about 1/8 of an inch to 1/4 inch thicker, because the muscles have deteriorated because they become beef jerky. You get it? Just like I told you, I don't care who you are, I can take anybody in this room and I can work on from your sacrum right up to your cervical, and I will go in and do each disc in between your vertebrae, and you'll be 1/2 an inch to 1.5 inch taller within 45 minutes. So everything is a scar tissue issue. So we would go in here and we would go in, like I said, we would break all this up. Because does nobody get this? She's so cold here, which means there's no circulation. So why isn't there circulation? Well, there's got to be a physical block. And we can get rid of that. But we're not going to get rid of it by taking supplementation. We're not going to get rid of it by energy medicine. We're going to have to go in there and lovingly take it apart. And that's why, my friend, how long have you been a practitioner?
1980.
And that's why most people that you work with and everybody else work with don't actually get better. You turn the burner down, but you don't turn them around and make them young again. Most people don't do it. And I'm not picking on you. I'm telling everybody here that we've all been sucker punched. And let me tell you something. When I was 25 years old, I said, this stinks. I'm working my butt off and nobody are getting better. And I've got all this education. All right. And understand something. You're not going to find the education you need in anything that is government approved. So guess what? I am not government approved, but I am approved by the World Organization of Natural Medicine. I'll tell you that much. All my courses are. And I never want government approval, because to have government approval means I have to give myself away. Means I have to kowtow to their rules. And I only go by universal law and nature's law, and I go by nothing else.
I don't have a problem.
No, me and you are
I'm
talking.
agreeing with you.
Yeah, I never said you had a problem. I'm trying to tell you that we have to take things into our own hands.
Yeah, I do things that my colleagues wouldn't necessarily want me to do.
Yeah. So all I'm saying, guys, is guess what? If it's not working, then you got to change it. And you can't do what everybody else is doing because nobody else is getting really great results. And you've got to bring it home. You've got to bring love home. You've got to bring the therapy home. So you've got to become the therapist, because guess what? How many people in your family? How many people in your family? Everybody in your family has a joint problem, muscle problem, tendon problem, has an emotional problem. So guess what? What kind of therapy do they need? They're never going to get it. You got to bring it home. So here's the deal. So I would be telling you, okay, that if I was in your situation, what I would be doing is I'd be taking lots of curcumin cayenne 5000 to bring the fire up. I'd be doing structured water. I would be drinking lemon cayenne and honey throughout the day. Keep it warm. You always want to do warm water in the morning to get things going. Okay? I would be doing SAC calcium if I could afford it. I don't want to break anybody. I'd be doing fulvic acid to bring down the acidity that she's creating. Until the nervousness is gone, her actual voice is triggering her adrenals to keep pumping out because there's an underlying fear of life.
Okay, so if that part's taken care of, would you look at changing shoe gear? Would that be of assistance to her as well? Would have to keep the crystals from flowing down?
Well, no, we don't even need her to make any of these changes, and I could go in and reverse this. The reality is, will it stay reversed?
Yes.
Okay, that would be with healthy thoughts, healthy diet, learning how to create the perfect day, and totally loving and honoring. Now I can tell she loves and honors herself. So there's something in deep within her subconscious. And when she was younger, we won't get into that today, but this woman was terrorized as a little girl. And that's obvious. But she's got to let that go, because you create a personality around your childhood reality. Do you understand? From 0 to 7, you've already created 70% to 90% of all the beliefs that are going to run you until you leave this planet, unless you're going to become conscious of that. You know what I'll do when I finish? I'll work on you. Okay? Before I leave. Okay?
Sure.
So you can but I will work on you, and we'll do that, and in 15, 20 minutes I'll prove I'm right. I just don't want to do it right now. Do you want to come up? Because I really want to get this moving. And I make sure that you watch my clapping and patting class.
Yes.
Okay? That's going to be really important. Okay? What?
Did you already have it?
Yeah, you missed it. It was like when you went to the bathroom. No, I'm kidding. So anyways, in 3 weeks, I'm going to be doing a 2-hour training on how to do your whole body and how you...
You had to send us an email. I didn't get an email saying that you were having the...
I'm going to be announcing it on my show.
Okay.
On my Doc Talk and my Q&A. I'll be announcing it. It'll be on Facebook. I'll put one little thing. Because guess what? Everybody thinks I'm nuts already, bro. So I am not going to put this on YouTube. You're going to have to opt in to watch me do this, because... Yeah.
But you didn't do it yet, right?
No.
Okay.
I did it. I'm just that fast. Okay, all right. Okay, so as you can see here, 1 second. Okay. All right. So why don't you tell the story about this, okay? And then I'm going to actually lay him down, and I'm going to work on it, and I'm going to make it softer, and in just a few minutes, I should be able to bring it down maybe 10%. But if I were to work on this, but he would have to help me out though, okay? Because you don't get this because you love yourself. Okay? All right. Go ahead.
Okay, in 2012, I think it was, I had a tumor on my nose, just a tumor on the nose. And it was bigger, so I went to the doctor, and they said that, well, it's not cancerous, so you send it to Iowa lab, but we don't know what to do with the hole. That would leave if we removed it. So I said, well, I don't know what to do either, so I went no further. Then I had a biopsy done, pressure from family, I guess, and other things, to get a biopsy and see what happened, because I wanted to get it removed and have plastic surgery, have it fixed. Well, they said they couldn't do it because they said it was DFSP, which is dermatofibrosarcomas protuberans. DFSP for short.
And I just want to say something. I'm not trying to pick on anybody, but it's arthritis, not just inflammation in joint. It's not colitis, inflammation in colon. Nobody wants to speak English. They want to speak in Greek because you're just too uneducated to look after yourself. Just like every drug. I mean, where did you get these names? Let's all get stoned. Okay, I got a really good name for that drug. Whoa. Okay, all right, go.
So then I went to CTCA to have further diagnosis and so forth, see what they could do. Well, they said they have an 8-hour surgery. Well, when they did their biopsies, scoot back a little bit, they put like 20 needles in my nose area to do the biopsy, and they took it all out, and one day it grew all the way back in my nostril.
Okay, so here's the deal. You cannot terrorize the tissue and not expect to have an issue. You cannot poke, you cannot prod, and you cannot cut without having scar tissue or irritation and inflammation. Okay.
So then I was scared from the doctors because it grew back.
Can I just say 1 second? So the reality is sometimes we need to have surgery. I know that. Sometimes we need to do things. But the thing is you got to get this, okay? This could be a whole hour discussion, all right? And that's this. Whenever the body has inflammation, it will always, what will it do? It will always do more than it needs. Do you know what? When you love your children too much, you hover over them too much. Your body loves you so much that it will always overheal. It will create too much scar tissue, too much crystallization. After every time that somebody has an illness, especially surgery or anything like that, or any kind of accident, you got to go in after the healing and get rid of all that displaced calcium and get rid of the scar tissue. Because guess what? How many here people talk about their war wounds? Oh, wow, why are you limping? Well, when I was younger and I played football, I injured my hip. Wow, that's really great therapy. Are you like crazy? So understand, nobody needs a cane, hardly anybody needs a cane, a walker, a wheelchair, or be in a nursing home. We are so dysfunctional as a society that we don't even realize that we're made out of tissue. So we never go in to fix the issue in the tissue. Did anybody notice that we have thousands, tens of thousands of therapists, and nobody's ever talked like this until today for you. So that's the reality. Isn't that something? And that's how good they've brainwashed us. All the great natural practitioners, and they're still missing the mark. Okay, go ahead.
So then I went to CTCA. They said 8-hour surgery, and I could lose eyesight. I could lose teeth, because I had little bumps in the cheek area that were like pimples, but they said that was, and on the line on the other side by my lip. So it went these three areas: nose, lip area, and around the top of the cheek. So my wife and I said, well, I don't want them to cut you up. So I decided to stop there, went home and changed my diet, lost 70 pounds, 7 inches, I do health testing, chemistry tests. But a year and a half ago, this started growing.
Okay, but what happened 2 years ago? There had to be an emotional crisis in the family. He was unable to process it. The emotional crisis is now stored in his cheek because he couldn't chew it, couldn't swallow it, couldn't digest it, so now it's in his cheek. Okay, what happened 2 years ago?
Well, my wife left with children, and 2 years ago, she said that she forgave me for everything, and I told her, well, I forgive you. And but then a month or 3 months later, it was like she did it, and she just made claims about me or accusations about me, which were true in the past, and she really didn't seem to forgive me, from what I could see.
But you have to understand something. For her, that was a survival technique, that she had to make those claims because she felt that to survive, she had to do that to get out.
Yeah.
So God loved her anyway.
Yeah.
Okay.
And I love her.
But see, you didn't.
Yeah.
Okay. All right.
So anyway, that's about how it stands now. I watched your videos. I did 3 days of fasting.
But you know what we need to do, to really win this thing is it takes really dedication. It doesn't take a lot of money. It takes dedication. And that is he needs to do 12 days minimum. And he needs to do like a 12 to 18 day water fast. He needs to pray. He needs to meditate. He needs to be connected to his breath. And he needs to understand and totally forgive himself and everyone else, and totally understand that that which created the universe has always loved him. Yes. How's that working?
I got this.
I know you do. Okay, so I'm going to do a little bit of work on it. Not a lot, but I'm going to do some work on it just to show you. Okay, so the more angry something is, we have to make sure that we do the surrounding area, but we don't have a lot of the surrounding area. Usually what I would do here is we go in and first, you see the TMJ? Okay, now please excuse me everyone, but this is called the FU point. This is where we hold our anger. FU point. So this is where we hold our anger. First thing I would do is I would go in here. Do you have a hearing problem yet on this side? Okay, so I would go in here and first release the TMJ, and I would go in here and work up around, okay? And then I would come underneath, and I would release his jaw, because under here we're going to find scar tissue and crystallization. So I would do all this area first, come up here, release this, and even come up here, and then I would release on the other side, the other cheek, release it because it's sympathetic to the other. And then I would do that. So that's what we would do first if we were doing the treatment. And then we would see how that reacts. And then we go in, give it a day break. And then if he was at my clinic, we'd use Biotron, Avicin. We'd use, I have an original Tesla noble gas machine that we would use on this. And then we come back the next day, and then I would start looking for weakness, because there'll be weak points in here, and we'll start softening it up. So I'm just going to show you 5 minutes of work, and then he's going to tell you if he feels any difference, okay? All right?
I'd like to say this too. I had a spiral fracture in my ankle first, so we're talking about blocks. It's all going on my left side.
Yeah.
So I've had spleen, maybe difficulties with the spleen area all the way through this. So,
Would you say that the biggest issues you had were with your children, not your wife?
possibly. I didn't know what to do.
Yeah, okay. All right, that's where the block is.
Will you be producing after you do your, what are you gonna do? A lot of swallowing?
Okay, first of all, we're not attacking.
Okay.
This is not about attacking. This is lovingly going in and pulling things apart. Now, is there going to be tenderness? Well, guess what? Lactic uric acid glues it together. So I'm going to pull the fibers apart, so there's going to be some tenderness. But nothing is going to feel abusive.
No, I'm just asking, would that produce some swallowing?
Swallowing?
Yeah, would that, if it starts producing any liquid coming out, should he swallow it or should he spit it
Oh,
out?
no, there's no liquid going to come out of this.
Okay.
Okay, no.
After I did the 3-day fasting, I had so much acidity right here coming out that I was having a hard problem swallowing.
So what he should have been doing is using essential oils, okay? If it was me, I'd be using what's called immunity, like I did already. Is I had a sort, like, remember earlier I was starting to lose my voice? I took 2 drops of immunity, put it in my mouth, mixed some saliva, I swallowed it, my voice came back. So understand, so, he can do that, and he shouldn't be putting immunity out here, right? And the other thing is, what do you do for a living?
I work I'm a machinist.
Okay.
Work with iron.
Okay, all right. All right, well, let's just do this, and then I can let Howie do his lecture, okay? All right? I don't want to steal the whole afternoon. Okay, let me set this up. Why don't you just lay here on your back? Okay? All right? Okay. Yeah, let's lay on your side, actually. Lay on this side. Okay. Yeah, okay. Okay, now do you feel me pulling the fibers apart already? Why isn't anybody doing this for him? So what we would do is we would do a little bit today, and then we would say, okay, when the tenderness goes away, call me that very day, come back in again. And I guarantee you we're going to reduce it smaller and smaller and smaller. And I'll tell you something right now. Once we get it down low enough, I would teach him how to pat and clap. I would also teach him some other techniques that he can do on his own, okay? So I'm going to prove to you, okay? Who wants to come up here and just feel this? And then you come on up and feel it, okay? Feel it, and then what I want you to do, just feel it, like really feel all around it. And I'm going to work on it for just 3 to 5 minutes, okay? So the area I'm going to work on, let's say, I don't know where it's going to be, but watch where I'm working and then go in and tell everyone if you feel that I just made a dent. All right. Am I hurting you?
No?
Absolutely not. Let's make that perfectly clear. So, you could go travel the world and people would not work on it. They would inject it, they would do IV, but they will not work on it. Now, did you ever notice something too? Do you ever notice all the laws about not touching anyone? I wonder why that is. Because we're all perverts?
Because those that are messed it up for everybody.
Okay, guess what? He feels it coming down already. Don't you? Yeah? Oh my gosh. Okay, 20 minutes, I'll take this down by 10 to 20%. Is that good enough for you? Did I prove my point? Okay, here we go.
So we haven't felt that, and I think you probably think it's fluid in there, but it's more.
It doesn't matter. It's not fluid.
Okay.
It's not a blister, trust me.
So do you go around?
It's a technique. It's not like you're going to get it. Okay? You have to understand something. It's not just using your elbow.
Right.
Okay? If you go on my website and go to the A to Z Masterclass,
Right.
I teach you all about it, why it is what it is, okay? I'm going to show, she's going to tell you what kind of dent is in this thing already. So what I would do is we would be working together and breathing together in a quiet place. Soft music on. Do you understand? It's all about that. He would be visualizing on letting go of everything, emotionally. He would be picturing the way he would like to see his life. Okay? Oh yeah. Now he feels it. Feel me going deep?
Mm-hmm.
Okay, I'm right on a root. Feel the crunching?
Mm-hmm.
Okay. Okay. It's coming off. It's loosening up off his cheek. Okay. So now it's going to move around. So what I did was, you could go watch a video that I did on. It's up on YouTube where I worked on a woman's breast. Okay. Her name is Oksana, and it was frozen. The tumor was frozen in her breast. After 15 minutes, I took this and it was moving around like all over the place. Okay, you want to feel here? Look at this. Tell them what you feel now. Feel it. Huh?
It's a huge difference, even from the front to the back.
Look at this. I took it down. So I'll keep going. And you'll see the difference with your eyesight when I get done here.
You'll see something.
Okay, now I'm going to get right underneath the root, where it's rooted into his cheek. Here we go.
Right underneath that zygomatic arch.
Yeah? You got it, sweetie. And guess what? That's where it's rooted. And guess what I said? The TMJ is the anger point of the human body. You made me so mad! Are you now allowed to speak? Yep. If I would have went in there when before this grew and got rid of this, he wouldn't have grew it. And people are going, that's BS. Well, I'll tell you, no, it isn't. Okay, it's bouncing around now, isn't it? Okay, now, oh, did you hear the crack? Did you hear it? Now it's cracking. There it is. It's coming apart. Okay, he feels it. Now we're taking it apart. I'm not going to do too much because this is not the most peaceful, conducive room. Here we go. It's coming apart. Okay, now tell them what it feels like. Go ahead.
You can see it in the movement.
Yeah? Okay, now I'm going to stop. Why? Does anybody notice he's going to have a black eye?
Yeah.
And I did not punch him, did I? I did not hurt him. What I did was, look at this. Look at it move now. I released anger. What did I tell you? it will go gray-black in this area because he is choking off part of his life. Do you want me to do some more?
Yes. Yes, go ahead.
Okay, all right. What are you feeling emotionally?
Cried.
That's right. That's right. And if he doesn't cry, if we were alone, he would cry. And while he's crying, you might think this is cruel. I would not stop. Why? Because as soon as he starts to cry, guess what will happen? The tumor will fall apart. I'm telling you, I know what I'm talking about. I've done it thousands of times. If you're not willing to let go, you will become cement. And you will crumble under your own dysfunctional beliefs. Here we go. If you want me to stop, you just say it. And it will be not because of pain, it will be because of emotion. He'll need a breather because he will feel threatened. Okay, here it is. Now we're going in. There it is. Come over here and feel this. Now. Okay, now feel it.
Much more cloudy.
Yeah, see? Look.
It looks so small on its
Okay,
side.
so I took it down, guys, by a quarter of an inch right here. Look at this. It's not round anymore.
No, it's flat there.
It's flat. You okay?
Yep.
What are you feeling?
Let's go.
Release.
He'll be following you to Orlando.
What?
He'll be following you to Orlando.
Last night I had 6 hours of sleep. The night before, 5 hours. So no, he won't. I'll be hiding out tonight. I have to catch a plane at 5 o'clock in the morning
So do I.
because I've got a show to do on Monday. Okay, here we go. Okay, now I want everybody to just really hold the light for him. I'm going to close my eyes now and do some real work, okay? Please turn your phone off.
I thought I had it all. I shouldn't do that.
Here we go. Here we go. Let's do this together. Okay. Look at it now.
Yeah, it's flat on one side.
Yeah, have I proved my point?
Yeah, it's flat on one side.
Okay, all right. I've taken it down by 20%.
You can see from here that it's.
Be able to tell when he sits up. You can't tell now. Could be
Okay, now I need you to lay on your back, and I'm going to take it down even more. You're going to be okay?
Could be less.
You may have a black eye tomorrow, okay? All right. Look at this, guys. Look at this. Look at this. See how it's moving now? Okay. All right. Here we go. He's with me. Just breathe it out. Am I hurting you?
No.
That's right. I hope everybody gets that. This is why people get trained in this. But you don't have to do this. You can get rid of bunions. You can get rid of somebody who has to have knee surgery, hip surgery, spine surgery. You can get a woman who's had a cesarean. She can't make love anymore because the roots are grown 2 to 3 inches off the surgical scar. She can't poop properly, and guess how long it would take? 15 minutes. After 10 and 20 years of pain.
You always use your elbow?
Well,
That's his technique.
hold on a second. The hands have never gotten anybody well in massage. Have they? They've reduced their pain, but they keep coming back. He's not going to have to come back. You can't, how do you take scar tissue apart with your fingers? It is impossible.
It's just a question.
No, I want to make a point. Because guess what? The whole world uses their hands, which are out of touch. And you cannot take a fiber apart. I can feel a grain of sand in his face. I can tell whether it's calcium, crystallization, or scar tissue. And I can tell you right now that massage doesn't work. People go.
It was an RMT.
No, well, so what? I was an RMT, and after 1 year, I said, this is goofy. All I'm doing is just wearing myself out. And I don't mean so what. It's great information, but if you want to get in there and make a difference, if you're not pulling the scar tissue apart, what are you doing?
Temporary relief.
Temporary. That's right. And I'm not downing RMTs. Here we go. Now guess what? 5 minutes, if I stay here, you're going to see a miracle. And it's no miracle. Okay, I need to be quiet. Okay, come here. Look at this. Okay, you want to see the death coming out of the tumor? Okay, remember what I said about black? I'm getting it, that's out. So he's going to have to make sure, that he has a clean diet. And I'm going to have to stop. Look at this though. Look at the difference. Look at this. Look at this.
Yep. What do you love a black eye?
Yeah.
But you know what? I've given some of my best black eyes to my elbow, but that was my
I would like to do more, but his body won't be able to process it. So what we would do is, I would have somebody like you, and they would come in once every week or 10 days. Look at this, guys. See how it's moving now? Okay, well, I've totally loosened it up all the way along here. Do you see his chin shivering? We're done now. Because he's shivering. Why? Not because he's cold, because he's unable to process the emotion that he couldn't when his wife left. So now he's having to go through the same thing, and if you ask him, he'll tell you he's feeling the same thing that he felt then. Let it go, man. Just let it go.
Yeah.
Let it go. It's okay. It's okay. It's okay. It's okay.
We're gonna give you 18%, Darrell. 18% in 10 minutes.
Yes, sir.
When he sits up, it could be more. But here, this
Yeah.
lying down in this position, it's
So I have registered massage therapists. Every natural therapist in the world is helping to shine the light. I just want to teach every registered massage therapist how to do this. That's the only point.
no. Here's one. She's in Kentucky. How are you with bluegrass? That's down there. That's what you smoke.
Unless it's a detoxification.
So flying up to BC, are you?
A tumor is a vicious rumor that we couldn't release. Just relax. We're done.